supposed to tell a little bit about myself, and usually that, should be, oh, I've born and raised here in Kansas City, but that's not actually the case for me. I was raised on a cotton farm in the Missouri Boot Hill. I spent the first 18 years of my life there, and it's where my family lives. I was fortunate enough to go to the University of Missouri. And after college, I chose Kansas City to make my home and to put down roots. I've fallen in love with this place. And as I approach my 20th year as a Kansas Citian, I can't think of a better way to celebrate that than to have the opportunity to be the senator from Kansas City. So really love this place, and it has been an honor to serve for the last 4 years. If I do get that honor of being senator, I'll have two distinctions in the Senate. One being that I will be the only openly LGBT member of the Missouri State Senate. And as far as I can tell, I'll be the only member of the Senate who has spent extensive periods of my life in the most rural and the most urban parts of our state, which gives me a unique perspective on Missouri and what challenges we have and how we need to face them. And what I see when you look at the most rural and the most urban sections of our state is the issues are the same. We're worried about transportation. We're worried about public transportation. We're worried about our schools. We're worried about poverty and crime that's associated with that. And we're worried about access to healthcare, access to doctors and nurses and the physical and occupational therapists that we all need at one point or another in our lives. And so whether you live in the 7th Senate District or in the Boot Hill or in Northwest Missouri, these issues are all the same. And so I ask you to forgive me. I have some notes here you all sent out the list of questions, and they were very detailed questions. So I typed out some notes to have. I support direct access to physical therapists. We need to have that. It's, oftentimes having to go through a physician first serves as a barrier that can delay the therapy that patients need or even deny it. And not to mention the fact that that's going to cost the patients more money to have to do that visit. I think licensure compacts are very important to recruiting and retaining quality providers. I also think it's important that the licensure board and practitioners are included in the discussion of compact agreements. So that's something that I will be keeping an eye on. My parents still live in rural Missouri. They're in their 70s, and I want to make sure that they get to stay at home as long as possible before they move in to my house. That day will come at some point, but I want them home and living independently. And so occupational therapists are so important in that respect. It's been called the silver tsunami that's hitting as the baby boomer generation is aging. We need to be able to take care of them from a humane standpoint. Keeping people at home is important. But also, as you look at the Missouri state budget and with our Medicaid population, it's a cost saver for the state of Missouri to invest in occupational therapists and keeping people at home rather than paying for them to be in a nursing home. So whichever way you want to look at it, it only makes sense to support keeping Missourians in homes as long as possible. And there was a question about, making sure that children with disabilities have access to this sort of care. Really, it's children and adults. People with disabilities, they deserve to be in their home as much as possible, living as independent of lives as we can possibly provide. So we need to do everything we can in state law and within the budget to make sure that is a reality for Missourians who are living with disabilities. Those are really the things of the questions that you all had thrown out there that I really wanted to tackle. I'm happy to answer any questions, either here or offline. I'll go into the chat room and I'll put my email address, website, that sort of thing. If you want to reach out to me, I'm happy to discuss any issues. But again, thank you all for hosting this and for allowing me an opportunity to speak.
Thank you, Greg. I know that one of the questions we received in advance was, how will you continue to advocate for essential healthcare workers, PTs and OTs after the COVID crises are over, or as the COVID crisis continues and people tend to move on and forget?
Well, that's something, I would like to have more of a conversation with you all about. What are you doing at this point as far as COVID to keep yourself safe, to keep your patients safe? I think we have, during this crisis, realized who, our essential workers really are. And you all are essential workers. Our food supply chain folks, from farmers to the checkout clerks at our grocery stores, are part of those essential services. And I think we need to rethink as a society who we're really taking care of. And you all take care of people for a living, and we've got to make sure that we take care of you.
And I'm sure people can comment here in the chat box if you'd like, but I know that it certainly depends on where we work, the level of PPE that we're provided with. I think all of us in some capacity have worked with a patient who's COVID positive or who tested positive after we may have worked with them. It's definitely something that's impacting a lot of us presently.
It's impacting everyone, quite frankly. I want to give a little shout out to my colleague, Representative Joe Runyons, who is currently the state representative from Grandview, and he was the first member of the General Assembly to contract COVID. And he and I were texting while he was in ICU for 5 days. He's in his 70s, not in the best of health, and it was, quite frankly, a scary time. And I'll say that while he was there, when he first got into the ICU, he texted me and he said, "Greg, I want to talk to the governor today." And I thought, well, okay, I'll see what I can do, Joe. And we worked some channels and got him on the phone. And while Representative Runyons is in ICU on oxygen, he's talking to the governor and saying, these doctors and nurses need the PPE now. I'm here, I'm dealing with this. You have to help take care of those folks. And it was a great moment, frankly, that while he was in that condition, he was thinking of you, and Joe and I are very close, and I hope to take that spirit, hopefully not the situation, but that spirit with me to the Senate.
Well, excellent. If anyone has any questions, you can ask. Otherwise, we can go ahead and start with our next speaker, if that's all right. Our next speaker that we have coming up is Patty.
Thank you, Clarice. And first of all, thank you, Clarice and Stephanie, for organizing this event. I'm so excited to participate in the Rehab Professional Town Hall. And thank you all for taking time out of your busy schedules to join and learn more about the candidates this evening. My name is Patty Lewis, and I'm the Democratic nominee for State House District 25. So it's the seat that Greg currently occupies. I'll be filling his spot, and I know I've got some big shoes to fill. But District 25, if you're not familiar with the area, it starts on 47th Street on the plaza, and it goes south to 435, State Line on the west, and extends east to Oak/Holmes. So it's Brookside, Plaza, Waldo, and part of South Kansas City. So just a little bit about me. I've been in healthcare for 20 years as an ICU nurse and as a healthcare executive. I've been advocating for people my entire professional career, from the most vulnerable patients in the hospital to the teams I've led. I'm an experienced leader who knows how to get things done, and I do not shy away from a challenge. I was born and raised here in Kansas City, Missouri, and I've been involved in community service my entire life. And I decided to run for state rep because I'm extremely concerned with what's happening in our state. Poor legislation and policies in place are leaving folks behind. They're failing us. And I feel compelled to advocate for you and all Missourians and fight for a better future for us all. One of my top priorities as well as the top priority of the voters that I've spoke to is healthcare. I believe healthcare is a right, not a privilege. And when we talk about healthcare, it's comprehensive healthcare, PT, access to PT, OT, mental health. So I'm super excited to be in this group of healthcare professionals. I'm right at home. I'm like Greg, I have some notes. I appreciate your well thought out questions. I want to make sure I address them all. There was a question about my experience with OT and PT. Well, I have years of experience on the professional level and on a personal level with PT and OT. As a nurse, we were a team. We worked together. We were ambulating patients together in the halls. In the ICU, we know that's really challenging with the IV poles, the oxygen, just to get their steps in 3 times a day. We bathed patients together, got them dressed, and I learned a lot from you. You all taught me how to use a gait belt, how to transfer a patient safely. And if I was having a crazy shift in a very critical patient next door, you stepped in and said, Patty, we'll dress and bathe your patient today. We'll ambulate them on our own. We got this. We've been a team, and I appreciate the partnership, and I look forward to continuing the partnership as your representative in Jefferson City. On a personal level, I have many friends and family members who have benefited from PT and OT, including nieces and nephew and my mom. She had a total knee replacement a few years ago, and we know that rehab is critical to the success of that surgery. Through her Medicare, she was able to participate at-home therapy as well as outpatient, and she had made a full recovery. And me personally, I've had experience with PT. I had 2 back surgeries, once in high school and once in college. And then in my mid-20s, my back flared up and they wanted to do another surgery. And I said, no way. So I went to physical therapy, learned exercises for my lower back, and I continue to do those every single day. And I have avoided a 3rd surgery. So thank you for all you do for my personal family and what you do for everyone out there today. As far as my views and stances on some of the issues that are important to you, I support licensure and licensure boards for healthcare professionals. We absolutely need them. I support the requirement to be licensed and have a license in order to practice. This is critical to the profession as well as patient safety. I support licensure compact and portability in the state of Missouri for occupational therapy, just like we have for physical therapy and nurses today. I also support direct access to PT without a physician referral. We need to remove barriers and make access to PT and OT more accessible and affordable for everyone. Our seniors, our adults, our pediatrics, inpatient, outpatient, and in the home setting. I strongly believe in preventative health care. Many times, PT and OT services can prevent invasive procedures and surgeries. Currently, Medicaid does not cover PT, OT for adults in the outpatient and home setting, and this is just wrong. As your state representative and as a healthcare professional, you have my full support. In Jefferson City, I will be your ally. I look forward to working with you, learning from you, and advocating for your profession. Once again, thank you so much for your support. I think I addressed all the questions, but I'll pause right there and see if you have any other. Oh, I guess I'll address the COVID question. So absolutely, I will support you through the pandemic, after the pandemic. I know that during the right now, nurses have received quite a spotlight, but we are all one healthcare team, everyone. PT, OT, RT, laundry and linen, dietary. We all need appropriate PPE, and you need to be safe. I know you're putting your lives at risk to help others, and I will help advocate that you have safe working conditions. So that's my answer to the COVID question. Clarice, are there any other questions, or do you all have any other questions for me?
Not that I'm seeing pop up right now. I know others have been concerned about some of the federal actions with CMS. They proposed cutting payments to OTs and PTs through the CPT codes of approximately 9%. And even though this is a federal issue, I think it's something that also reflects something we've seen even on the state level with Medicaid. Reimbursement tends to be low for therapy services. In fact, OT and PT isn't even covered for our adults on Medicaid, which I think as Medicaid expansion perhaps moves through, it's going to be interesting how that may or may not change, but that's something that definitely you'll hear us knocking on your doors and sending emails about is how can we get OT and PT covered under Medicaid for our adult population?
Absolutely, absolutely. I look forward to continuing to work with all of you. And I spoke with Clarice a few days ago. I am unopposed in the general election, so I will be going to Jefferson City. I look forward to continuing to work with you all. And I know time is limited. I can put my website in the chat, so please feel free to visit my website. It has my contact information. I'll also put that in the chat. So please reach out to me. I'm here to represent and advocate for you. So please remember Patty Lewis for State Rep District 25. Thank you.
Perfect. Well, and we can always answer questions as we go along too. So if anyone who's attending thinks of some, feel free to enter them in, and we can always allow the candidates to enter since we are moving a little bit ahead of schedule. Up next, we have Chris Hager, and I believe that I saw him on. So Chris, I'll let you go ahead.
Okay, thank you so much. Thank you for having me on this evening to join everybody here and talk to you about your profession. And I'll tell you a little bit about me. So my name's Chris Hager. I'm a lifelong Missourian, and my wife and I, we've lived here in Lee's Summit for over a decade, and I'm running to represent the 34th district. I'm running as a Democrat, and that district is most of Eastern Lee's Summit, Southern Lee's Summit, and Greenwood. So like I said, we've been here for over a decade. We've got 2 kids. We've got a daughter who's in school now, and we're really passionate about our community and about the success of the people that live here and work here. Lee's Summit is a big center for the medical industry and the healthcare industry, and so it's really vital to see success in that area. Real quick, we'll run through some of the questions that you all sent, because I certainly want to be sure to address those. I've sought physical therapy myself. Last year, I was dealing with some hip pain that was really making it difficult to sit, to stand, to move around without a lot of discomfort. And I was fortunate that it wasn't debilitating, but it was certainly very distracting. So fortunately, my healthcare plan allowed for physical therapy. I was able to go in and see somebody, and after several weeks, I was able to find some relief. And then the physical therapist armed me with the knowledge and the exercises I needed so that I could treat myself if it flared up again, which I was very grateful for. So finding somebody who was so skilled in what they did that was able to locate the issues I was dealing with and address them was absolutely key. I've had family members deal with physical therapy and occupational therapy. My grandmother had a knee replacement a couple years ago, and her therapy sessions were key to her getting back mobile again. My views on licensure and licensure boards, I do believe that licensure is very important to validating and recognizing the standard of skill level that professionals have when they're entering the field. And it also gives confidence in the patients, right? That when they're seeking care, that they know that they're in confident hands. I do believe that the licensure process shouldn't be overly convoluted or an obstruction to achieving a professional status. I don't think that money should ever be a barrier to somebody who is skilled and talented achieving their professional slot that they want to go for. So, in those regards, if there are opportunities to remove some barriers to licensure that are preventing people that really want to do this work, I'm for that. I certainly support portability, licensure portability and compact. I think that especially on the state line or near the state line, that can widen the patient pool for therapists. And I think it'll can provide them the flexibility to continue their work with minimal interruption if they were to relocate somewhere else in the nation. I also recognize that patients in some regions, we're talking nationally, may face unique conditions that they may not face in other parts of the country, and that should be taken into account when you're talking about portability. But I think that's just a minor consideration. And I don't think that should be disqualifying in general. Let me add that to it. So there's a question here on if I have any legislative intentions regarding the provision of healthcare or related healthcare providers. This is my first time running for office, and I'm paying very close attention to how representatives interact with constituents and with organizations such as yours. So I don't have anything specific right now, but I'm definitely looking for opportunities to support legislation that would support you. I think right now enacting Medicaid expansion, and somebody on the call here mentioned that it doesn't cover in-home therapy sessions. I think that's key to make sure that when we're talking about enacting Medicaid expansion, that we're looking at those opportunities to expand care. I also think that maintaining a healthy and able workforce is a benefit to the economy on the whole. And so from that, guys, everybody should be in support of enhancing access to PT and OT services, because if an employee stays healthy, then they can keep working. When it comes to direct access, I certainly think that direct access is a great idea, and I support it. It benefits patients by allowing them faster access to care. It benefits therapists through increased engagement, I believe. For example, you may have people that can't afford, frankly, a doctor's visit, but maybe that's the only thing they can afford to do. So they pay to go to the doctor, and the doctor gives the referral, and they can't afford to even go to a single session with a therapist. So if we can start that engagement sooner, I think that would be great. And I think ultimately it would benefit physician practices too by reducing unnecessary visits for them. As far as what role the state should have in regards to senior citizens aging in place and having access to services, I believe that we all deserve the opportunity to age with grace, with dignity, and in comfort. And whether that's through home visits or telehealth visits, I think the state should minimize the regulations and restrictions that would impede or obstruct this care by licensed professionals. Such services should certainly be covered by Medicare and Medicaid going forward. When it comes to the children with disabilities and access to health care, my answer is pretty much the same. I think we need to remove those barriers. I think we need to limit those restrictions that prevent the children and their families from getting the care and the support that they need. As far as what I believe that we should do for PT and OT workers whenever COVID ends, I think we should continue to support them. I think we should continue to support the industry on the whole, ensure that they have the support mechanisms that they need, whether it's through funding or materials, to do their work safely, to do their work correctly, to be in a position and in a place where they can continue to work and continue to benefit their communities and continue to thrive personally. So I want to thank you again for my opportunity to speak tonight, and I'm very proud to be up here with some very, very good people. Thank you.
Thank you, Chris. I appreciate it. Does anyone have any questions that they'd like to answer the candidates? I know that, Stephanie and I personally, we work with older adults and geriatrics. And so if there's any issues for any pediatric therapists who are on the line who'd like to ask, certainly feel free, because those are issues that Stephanie and I aren't always as aware of because of our nature of work. All right. And I know, Greg, you didn't get a chance to answer some of the Medicaid expansion or COVID questions. Would you like to chime in as we have a couple seconds available, or would you like us to keep moving on? It's up to you. I think he's still here. He may have logged off, so never mind. Alrighty, well, up next we have Connie. Connie, thank you so much for joining us tonight, and I will let you go ahead and introduce yourself. Take it away.
Okay, my name is Connie Simmons, and I am running for Missouri House of Representatives in District 53, which is a rural community. It includes all of Lafayette County, the very top of Johnson County, and the very eastern part of Jackson County. So we're just outside of Kansas City. It's a rural area, and healthcare is a huge, huge priority in our area because we are so far away from available healthcare. Hospitals out in the rural areas have lost funding. And well, to be honest, when we choose to go to a doctor or hospital out here, we have to drive quite a ways to get there, at least 30 minutes in any direction. And so healthcare is one of those things that is difficult for people out in this area. Look at the questions that you have put down. Experience with occupational and physical therapy services. Well, I am maybe a little bit older than some people. I'm 59. And several years ago, about 5 years ago, I had stem cell treatment on my knees. And the physical therapy that I had afterward was crucial to regaining and strengthening those knees. I also, just a year and a half ago, had total knee replacement on one of my knees. The issue that I came up against when doing this was my insurance only covered like 10 visits to a physical therapist. After that, I was on my own. Well, if you know anything about having knee replacement, it's going to take more than 10 visits to get your knee working again. And so I think that we need to look at insurance and what they're covering, because I decided to go ahead and pay on my own after the 10 visits because I didn't have full range of motion of my knee yet. So, but then the cost of that would be prohibitive to most people. I was lucky in that I could do that. I have two nieces actually right now that are studying to be physical therapists. One of them is going to the University of Daytona in Florida. And so this is an area that I've kind of kept a watch on. And the licensure and license boards, I think those are very important for any professional career. I was a school teacher and then a high school counselor. And so my licensure on those two subjects were very important. And also keeping up that licensure. I know as a teacher, I had to keep up with what was going on. And the times that I've gone to physical therapy, I know that in talking to the people that have helped me, they are always looking, always reading, always studying, always learning more about how to effectively work with different things. So the portability, that's one thing that I've always thought was funny about teachers. I'm certified to teach in Missouri, but I can't in Kansas without going to Kansas and applying for a license and taking more classes. It's the same thing that I would be doing across the state line, and yet the one side doesn't accept what the other side has already provided me. So I think that's something that needs to be looked at and make sure that licensure is available to several states. Legislative intentions with regard to healthcare and related to healthcare providers. One thing that I think is very important is the accessibility of affordable healthcare. Rural areas, we have a lot of farmers, they're self-insured, a lot of lower income people in my area. And when you think of those things, you think of where can they go? How can they get the healthcare? I'm very much interested in seeing how the Medicaid expansion is going to help a lot of these people, hoping that they'll be able to get the care that they need. It's a shame that some people have to think of whether they want to buy groceries or go to a doctor or go have help. And I also, when you think of allowing people to have direct access to a physical therapist, I think that is something that is a no-brainer to me, actually. When you hurt yourself and you think, okay, I'm going to go to a chiropractor, you don't go to your doctor to get a referral. If you hurt yourself and you know your knee is hurting or something is hurting, and you know that it's a sprain, you can tell it's not a broken bone, it's a sprain. Physical therapy is going to help you get better. It's going to help you build that muscle back. And you should be able to choose where you go and what kind of help that you get. I think that seems, like I said, that seems like a no-brainer to me, that you should be able to go to a physical therapist without having a doctor referral. What role should the state have in regard to senior citizens aging in place? I think that, you know, as I'm eventually going to approach that age, I hope, where I want to stay in my home. I know I took care of my parents as they were aging. And after my dad passed away and my mom wasn't able to take care of herself, I brought her into my home, and I was lucky to be able to have people come in and help her. She had trouble ambulating from room to room in her later years. And the help that she had in exercising and keeping her body moving was very important. And it seems counterproductive to not allow those services to be given to the senior citizens so that they can stay ambulatory and they can stay in their homes. What role should the state play in regards to children with disabilities? I don't think they should have any role in that, actually, because it's not for them to say what the child needs. That's a medical professional, whether it's a therapist or a doctor. They know what's best. The state shouldn't have the power, I don't think, to come in and say, no, you can't do that, or yes, you can do this one, but you can't do that one. That way, it just doesn't seem to be. It just doesn't seem to be productive for them or helpful. As a school counselor, I always had an open door policy. And one thing as a state representative that I would do is always have an open door policy. I want to be able to find out and know what the people in my district want and need. I want them to know that they can call me, they can email me, they can text me, they can get contact with me any way, because I want to know what is needed and what their wants and desires are. And that's what I want to do as a representative. I want to actually represent people. And the only way to do that is to know what the people are wanting. And so I tell people, as a representative, as a school counselor, I was a trained listener, a trained advocate, and a trained conflict mediator. All of those skills, I think, are what's needed right now in government, not just at our state level, but a little bit higher up too. So I want to thank you all for taking the time and listening to us. And I appreciate it. Thank you.
Thank you so much, Connie. I appreciate it. If you'd like, you can go ahead and share your website or email in the chat box. I know that other candidates have been doing that as well. If you all haven't seen that, that's a great way to get in contact and build a relationship. And I think that's something that, you know, that's part of why we want to host this event, is to build a relationship with our candidates. And that's the great thing about local representatives, is that it's much easier to reach out and contact you all at the state level than it is to ever get a hold of our federal representatives. And, you know, a lot of state roles are really what makes a big play in our professions and in our jobs on a daily basis. And so it's great to be able to connect with all of you.
Thank you so much.
All right, well, up next we have Ashley. I believe I saw that she's already on. So thank you so much for joining us, Ashley, and I will let you go ahead.
Well, thank you so much for inviting me. I really appreciate the opportunity to speak with you all this evening. I hope everyone's well in Zoom land. My name is Ashley Ani. I'm running for state representative in House District 14 in the Kansas City Northland. The district includes Kansas City, parts of Riverside, Platte Woods, Lake Waukomis, and Houston Lake. The boundaries are the Missouri River to the south, and we cover parts of Riverside. It goes all the way up to north of Tiffany Springs, and it sort of spans I-29 on each side. We've got a little bit of little bit of Parkville on the west, and Platte Woods, a little bit of Clay County actually, on the east. It's kind of a wonky district. Thank you, gerrymandering. So I'm a wife and a stepmom and a small business owner. I own a marketing agency here in the Northland. I've spent my career in the marketing and advertising industries, working with businesses of all sizes to find creative solutions to some of their biggest challenges. And incidentally, one of the industries that I've worked really closely with over the past decade has been healthcare. I've worked with big hospital systems like Mosaic Life Care up in St. Joseph, down to local private practice ophthalmologists here in Kansas City. And in between that, I've actually had several clients in the elder care space and the home health care space. So I actually have somewhat of an understanding of sort of how PT and OT comes into play, especially in the home health care settings. And, you know, as I'm a writer by trade, I'm a copywriter and a creative director. And as a content creator, one of the coolest things about my job is that I get to really take deep dives into what it is exactly that my clients do. And that gives me an opportunity to learn all sorts of things, what's going well in the industry, what their challenges are, how they want to relate to their patients. It's such a fantastic and fascinating experience to really get into these businesses and learn what they do and how they serve their patients. So that's just a little bit about me and my background, I suppose. To start addressing some of the questions, I do have experience with physical therapy personally. When I was 15, I partially tore my ACL playing soccer. And it was devastating to my soccer career on JV at the time, of course. But it was also an incredible lifesaver to have physical therapy there for me because I never had to have surgery on that knee. I was very, you know, I wanted to get back to playing soccer and into dancing. I wanted to have a healthy knee again. And so I did everything my physical therapist told me to do, which shocked my mother because I did nothing she ever told me to do. But it saved me from having surgery. And it was, I'm grateful to that, for that to this day. I was in physical therapy for months after the tear. And in addition to that, my mother actually broke her ankle. She fractured her ankle and walked on it for over a month before she decided to go have it looked at. So the woman's been in physical therapy on and off for at least 2 decades now. And so I've seen her journey and how much it's helped her. And you know, it's helped her recover from surgeries and all of that. So physical therapy has genuinely changed my life, and I have just a deep respect for what you all do, certainly. My views on licensure and licensure boards, I fully support licensure for healthcare professionals. I think it's incredibly important to help regulate the standard of care and to protect patient safety. But I also, you know, I support licensure compact and portability for occupational therapists as well. You know, as has been mentioned previously by other candidates, you know, especially here in Kansas City, when we're on that state line, we understand kind of what the struggle can be finding providers on the other side of the state line, and providers finding being able to serve patients on both sides of the state line as well. So those are both really important, and I fully support that as well. My view on allowing constituents to have direct access to physical therapists without a referral is that I, again, fully support direct access to physical therapy services. The specialist referral process is so frustrating, both as a patient and a provider. It creates a barrier to access for folks for many reasons. Time and resources being 2 of the top ones. And we all know that healthcare is already far too expensive as is. So if we put even more roadblocks up for folks, it's not doing anyone any favors as far as I'm concerned. And then what role should the state have in regards to senior citizens and children with disabilities having access to health care and occupational therapy services, and for aging adults having that access in their home? So again, I have a background in working with companies and organizations that provide home health care to aging adults. And I am super passionate about keeping aging adults at home as long as possible. It is not only giving them the opportunity to age with dignity, but it also keeps them more comfortable. And what we're seeing now, especially in light of COVID, is that more older folks are wanting to stay home, or their families are wanting to keep them out of assisted living facilities because of how quickly it's been spreading through those facilities. And so the opportunity to keep older folks at home is so important. And not to mention, it's a level of comfort that I think we all deserve. The idea of being moved out of your home at the end of your life is it's scary, and it doesn't provide a whole lot of dignity in aging. And so being able to provide PT and OT services to folks in their home, it's huge. And taking away any barriers to that is really important to me, and something that I support as well. And additionally, I actually have some experience volunteering with special needs kids. I did that for a long time in my adolescence and early adulthood, and making sure that they have the care that they need, whether that's in home, whether that's at their provider. Kids with disabilities, there's just such a spectrum of what they are and are not able to do, and what they do and do not need. And making sure that those kids and those families have the access to the care, the level of care that they need, when and where they need it, is so important. There are so many barriers for those families. It is a nightmare. And I've seen that firsthand, and reducing those barriers is it's just a really great first step into making sure that folks are getting the right level of care. I'm not sure. Have I answered all the questions? Did I miss anything? I'm looking. Let's see. I think that's all. Legislative priorities. I same kind of piggybacking off of what Chris said. I don't have any specific legislative priorities, but I am always looking for opportunities to partner with organizations who align with my political views. And if I can help you push something through the legislature, if I can help, support your work in your professionals, I would love the opportunity to do it. I'm happy to support legislation. Like I said, I have a background in healthcare marketing. I am no Patty Lewis. I cannot claim to be a provider, but I do know how to speak the language, and I'm deeply passionate about the industry. So.
Well, thank you so much for your answers, Ashley, and spending your time with us. We hope to see you up in Jeff City soon, whenever we get to go there next. Do you have any additional questions for us at all?
I don't think so. I'm happy to take any questions you all have. And if not, just thank you so much for the opportunity this evening. It's been great to be here and talking to you guys. And I always love an opportunity to learn more about the organizations who want to hear from us. So that was really fun as well. So thank you for the opportunity.
Awesome. Well, thank you. So next up, we have Representative Brenda Shields. She is in House District 11, and you can start whenever you're ready, Ms. Brenda.
Thank you. Hope you guys are doing great this evening. I am Brenda Shields. I represent St. Joseph, but also southern part of Buchanan County and the northern part of Platte County. And I have a story to tell tonight. Your first question was, have you ever had any experiences with physical therapists or occupational therapists? And little did I know on April the 16th of 2016 that my life would change forever. I woke up early. I went to work out with my trainer. And while I was working out with my trainer, I had two very sharp pains that went through my head. we were kind of doing interval training because I had a son that was getting married 6 weeks from then. And so we were working really hard because I wanted to look the best that I possibly could for this wedding. And so she said, well, let's take a little break because we're kind of doing interval training. And I started talking. I said, do I sound right? And she goes, well, did you eat breakfast this morning? And I said, well, no. So we kind of went through that. She handed me a water bottle and I couldn't open the water bottle. And I thought that was kind of strange, but she opened it for me. I drank it and I didn't want to appear old. So I jumped up and the next thing on the agenda was to do push-ups. And I did about 10 of them. And I said, my right hand and arm is not helping with this event at all. And she says, well, let's just call it quits for the day. So I drove myself home, and because fortunately I didn't live very far away, and I ate and I tried to lay down and go to sleep, but I couldn't. So I got up and I had to get ready to take my mom to the doctor, and I couldn't hold a single makeup brush in my hand. It wouldn't hold. So I called my husband, and before I could say much, he said to me, I'm coming to pick you up right now. And I went to the emergency room, and they quickly discovered that I had a brain bleed stroke. So I spent 5 days in the emergency room, and not in the emergency room, in the ICU, and was evaluated by a physical therapist and occupational therapist. But I was ready to go home. I didn't have any desire to stay, and I really didn't have any plans to take any physical therapy because I really thought that I was okay. And my niece is a physical therapist, and she came to visit me, and she says, Aunt Brenda, you need to go back into therapy. You need to be evaluated. So I worked for about 3 or 4 weeks, but I had things to do. I had a son that was getting married. So I said, I'm fine. I can do the rest of this at home. So fast forward now about 6 months, and I was in a tremendous amount of pain. And one day I just said to my husband, I said, I don't know how I'm going to live to be 80 if I'm in this much pain. And I really don't know how I'm going to live to be 60 if I'm in this much pain. He says, you need to go back to the doctor. And I did. He took one look at me, and really, he took a look at me. He had me walk, and he says, I need to get you back in therapy now. And I was in therapy then for about 4 months. And I am where I am today because of my speech and my occupational and my physical therapist. They helped my brain think again. My occupational therapist helped me, learn to do the things I need to do to get around the house, use my hands and all of that. My physical therapist made me strong and helped me stand up straight. I still, to this day, occasionally, my husband will say, you're not thinking about your right side and you're letting it kind of lean. And when we walk, he'll say, you're letting your right arm dangle and you're not using it. So I still have some carryover issues. I know I'm not the same person I was 4 years ago, but most people can't tell. And I cannot say enough of a thank you to all of you and what you do for your patients. I mean, you were, and I know it just wasn't the physical therapist or occupational therapist I had. I mean, incredibly patient. They lived through my tears. They helped cheer me up and tell me that there was a future and that things were going to be great. So I wanted to be here tonight to have this opportunity to thank all of you for what you do for all of your patients, because I know what you did for me. And I've had lots of other experiences as I was the primary care provider for my mother, and we were in and out of therapy with her many times. So that's my story. So now I'm going to answer some of your questions. There's some I don't understand, so I'd kind of like some feedback from you. You talk about your how I feel about licensure boards. From my studying, I believe that a lot of your licensure boards are filled with physicians that are evaluating. And I really think it's important to be evaluated by your peers. So be evaluated by those that do the same job and occupation that you do. So do we have an issue right now in that area?
Not as far as I'm aware. In OT, actually, we have our own licensure board that's supplied through fully with OTs, and then we have to have one public member. But the PTs are a little bit different. They have a combined licensure board. I think one of the main issues that we faced in the past is that there was a bill introduced in the Senate that was essentially trying to reduce barrier of access for people wanting to enter certain fields that required license. And unfortunately, in the list of medical professional exemptions, OT and speech therapy were left off that list. So if that bill were to have passed, it would have meant that someone could practice OT or speech without a license, which obviously was a significant concern for us because we like having licenses, we like having that legitimacy, and that's a lot of why insurance pays for our services. But also we want to make sure that we protect our patients and that they're not being treated by someone who either doesn't have our training or really isn't even a medical professional at all.
Okay. And you work really hard knowing that my niece is a physical therapist. I know you that your training is extensive. And so thank you for filling me in with what your issues are. You talked about your having portability with your license. I mean, last year in the legislature, we passed license reciprocity. And I know that you've shown me that occupational therapists, or I studied that occupational therapists have license reciprocity now. The issue is that Kansas and Illinois doesn't have it. But for physical therapists, you don't have license reciprocity. But I really don't think that would be much of an issue to pass in the Missouri legislature, for the fact is we just passed a very big license reciprocity bill last year. We actually passed two, one for veterans so that veterans' families could follow them and be able to work immediately in the state of Missouri. And then we did it for a lot of other trades. So I don't think that would be an issue if that is something that you're interested in.
So physical therapists actually had licensure compact pass a few years ago. We have
Okay, I have it back.
Yeah, that's okay. So
Okay.
there's a few over, a little over 20 states where physical therapists can move in between the states and do travel therapy or support an area that's been greatly impacted, like we did during the early days of the COVID pandemic, where Missouri wasn't hit very hard. There was therapists that were able to quickly travel to another state and be able to help patients in that area without going through the long process of like fully getting their license moved. And Missouri was actually the second state to pass that when we first started doing it.
But Kansas and Illinois have not passed this. So you're saying that there's 20 that have passed this,
Mhm.
and so it means we have 30 that have not.
Yes, it might be a little over 20. I haven't looked at the numbers
That's okay.
recently because
Close enough.
I enjoy my job here at North Kansas City, and I'm not planning on going anywhere. But they have tried to pass it in Kansas. I think just once. The issue that they ran into in Kansas is the state of Kansas requires additional malpractice insurance, and one of the conditions of the licensure compact is there can't be anything above and beyond that would be too difficult for somebody to get quickly to start practicing in that state. And so when they try to pass it in Kansas, they would need to repeal some of those additional barriers, like having that additional malpractice insurance. So hasn't worked well there, but I think they're working on it.
Are they working on it? I think in this day and age in which, I mean, if you think 30 years ago, people moved and they didn't move again. They moved, they set up their home and they didn't move. But in this day and age, people are constantly moving from state to state. And I think that we need to make it so that those that are licensed, like physical and occupational therapists, can practice their trade wherever they move.
And that's something for the occupational therapy side. And we definitely are appreciative of the fact that we have that licensure portability for military families. That definitely makes it easier on those families. I think so we have a new initiative for OTs that's hosted by our AOTA, our National Association, as well as our Boards Association, to introduce a licensure compact bill. And so this is something where we already have the bill text written, and we actually have the intent to try and get that introduced in Missouri. And so we will be looking for sponsors and co-sponsors for that bill. And so we're hoping to get that introduced for this upcoming session and hopefully get that passed early because, like Stephanie said, since Missouri was the second state on their compact bill, the first 10 states who passed the bill get to be the ones who kind of write the rules for the compact. And so that's something that obviously as Missouri, we want to make sure that we have our foot in the door and that we have a seat at the table in developing those rules for the compact. And so it's really important, especially, as we move into these age of telehealth and as that continues to expand, it definitely will increase access, I think, for practitioners to be able to practice easily in the state of Missouri and increase access for more of our rural residents. And so that's something that we would definitely be looking for support is for our licensure compact bill, or even for someone to introduce it on the floor for us.
Okay. So that leads into your next question. Right now, I do not have I do not have any healthcare legislative priorities, and I think that's where you were really headed with that question. I know that there are some things out there. Direct access for physical therapists is something very high on the physical therapist list. And you've had a sponsor for the past several years. I assume that you might use that same sponsor. I think we've gotten it through the House and we've never gotten it through the Senate, but that's kind of what the point of tonight is. I don't have any legislation that's related to healthcare, but tonight's a night in which we can talk about that and maybe see if there's something that we can do. I've talked about direct access. I think that the bill that we had last year for direct access for physical therapists was actually a good bill. It had some provisions in it that that they could only practice on a patient so many times, and if they weren't seeing results that they needed to, or they needed to go see a physician, because I think that there are times that some things present themselves as one thing and they're really something else. But at the same time, I know that as I've talked to my niece, I know that you're so highly trained that you can typically tell if it happens to be, if it presents itself as back pain and it's really cancer, that you can quickly tell that too.
Yeah, so on the direct access front, we will be presenting that bill again, spoiler alert. I know that we're aware that, there's bigger things going on. We will be having the same sponsor for that bill.
Yeah.
He is on fire for physical therapy and he's so excited about it. And so he'll definitely be presenting that bill for us again. I believe the plan is to introduce that revised bill that we introduced last year. 2 years ago, we had some good success. And one of the successes that came out of that was that different revised bill. 2 years ago, we went hard with the no restrictions. You can just go see a physical therapist. It's always better to go a little easy and then let you guys kind of shape it as you hear from all sides of the argument. And so I believe the provisions are without the physician referral for the first 10 visits or 30 days. And then if the patient hasn't had progress by that point, then you would need a plan of care signed by a physician, nurse practitioner, chiropractor, somebody that typically would refer to you. Honestly, usually in physical therapy, I know a lot of the people on this call have had, just as you've had experience in therapy, if we're seeing a patient that hasn't made good progress by that point, we're already starting to feel, maybe this isn't musculoskeletal, maybe something else is going on here, and it's time to talk to somebody else. And even, I know we talked with a representative the other day that had questions about whether or not there would still be referrals, and that is something that would still happen. Like for me, I work with Clarice at North Kansas City Hospital. I also work for our cancer rehabilitation department. That is a side of therapy that I always want communication with a physician. So even if I had a cancer patient or a patient with cancer come to see me to help manage their fatigue, I would immediately call their oncologist and say, what's going on with them? Do you feel about this? Are you comfortable with them coming to see me? And make sure that we're both on the same page, because it's healthcare is just collaborative and we need to be talking with people. So referrals definitely wouldn't go away. And I think that that's something that we don't always take the time to educate when we're up talking with you guys in the Capitol.
Right. And the other thing is there are a lot of people that don't think of a physical therapist first, to be quite honest. I mean, there's people like myself that knows the benefits of what you can do, but there are many people that will go to the doctor seeking a pain med and not realizing that with the right muscles strengthened in the right places, much of that back pain can go away. For, in my example, I was really lacking, muscle strength on the right side of my body. So I had a curvature kind of going on, and I had to learn and strengthen that right side to stand up. Mine was caused by a stroke, but other things can cause that too. And so I think that I think that there will still be referrals, because I think people will go to the doctor seeking the immediate fix me now treatment and not realize that it might take a few weeks to see the pain relief through a physical therapist. Yeah. Let's see. I'm sorry. Oh, I'd like to know your thoughts on question number 6, but I can't imagine that we wouldn't jump on board of question number 6, which why do we believe in keeping seniors at home and having occupational therapy in their home? I mean, we know that the cost of care is significantly less if we're able to keep a senior at home instead of in a nursing home. So I want to know what barriers we're facing, and why do you believe that this is difficult?
Most of the time, obviously, we know that the state doesn't necessarily control Medicare regulations, but for Medicaid for our older adults and for adults does not cover occupational therapy as an outpatient or as a home health service. So when we have patients who are on Medicaid and that's their primary payer, they are able to receive therapy services while they're in the hospital. But unfortunately, as soon as they leave the hospital or they leave an inpatient rehab facility, they're no longer able to receive that therapy. And obviously that makes it very challenging then for that individual to remain in the home, because I'm sure, as you know, your experience working through the medical system after your stroke is that while therapy in the hospital plays a key role in really jumpstarting that rehab, where a good chunk of that progress is made is after the discharge from the hospital, especially as lengths of stay have decreased. And so there's really no one going into that home to make those kinds of recommendations of equipment that may be needed, and to provide that continued training for caregivers or for the patient themselves. Fortunately, we do have coverage for occupational therapy and physical therapy in the home and outpatient for children. But when I was in home health, we would have the occasional instance where we'd have a child who is just about to turn 26, and we're trying to get in some last minute therapy so that we can provide the training for the child as they're growing. And obviously, just because an individual turns 26 does not mean they no longer have a physical disability or developmental delay. And so it's very challenging for those parents for us to go in and say, we're here to support you, but unfortunately next week when their birthday comes, those services will no longer be covered. And I know we've had issues with that where there were some changes in the requirements for children to be able to receive access to Medicaid. And I think that's something we'd like to ask you as well, is since you have been you are an incumbent and you have been in the state legislature, how can we help facilitate changing those Medicaid requirements and changing that Medicaid coverage, especially with Medicaid expansion now on the horizon? How can we help make sure that these services are covered for individuals who need them and really help get these people, back to work and get them independent?
I will tell you, education of the legislature is the number one item that you can do. We elect 163 people. Doesn't mean that they're experts in every area. For example, for me on the occupational therapist in the home. So if you're released from the hospital, you can't have occupational therapy at home if you're on Medicaid
Or
Correct.
physical therapy.
or
You
physical.
can't receive any of the therapy services.
My mother, I guess my mother had private pay insurance, and that physical and occupational therapy that happened at home, even though she was in rehab for quite a while, she had to figure out how to shower at home, and she had to figure out how to live at home, and she had to have the physical therapy so she could figure out without the machines how she was going to continue to build her strength. So I didn't realize that we don't cover those services on Medicaid, because we were able to bring her out of the rehabilitation services that she was in the hospital, and bring her home, because we were able to provide those services at home, which is a much more comfortable place for her to heal. She was incredibly excited to be at home, so her motivation to work was much, because I hate to say we would hold it over her head, but mom, if you don't do your exercises and do the things that you're supposed to do, then you might have to go back to back into the hospital and back into the rehab in the hospital. And so it was I find that interesting. I will tell you that Medicaid expansion, it will probably be a battle in the legislature. I believe that the Missourians passed it, and it is our responsibility to implement it. So we have to figure out how we're going to make that happen. Next year is going to be a very tough budget year, and of course, when it's hard for people, to see. They see the expense as savings, a continual education that you need to do with legislators. For me, I did not know that Medicaid didn't cover this. As I said, my mom had private pay insurance. I thought everyone had this option, because I truly believe that we were saving money for everyone involved, because we brought her out of rehab probably 3 weeks sooner than we would have, than if we didn't have any services at home.
And of course, that's kind of how that's exactly how we feel as well. Medicaid will cover for someone to go into long-term care and assisted living, but unfortunately they have to get to such a low point of ability to care for themselves and ability to ambulate. And so really it's just kind of, you start playing a point of waiting for someone to deteriorate to the point where we have to make them remove themselves from their home. And so that's something that could have been prevented had we been able to intervene and provide them with services. And, occasionally facilities will pick up a Medicaid patient pro bono, but unfortunately, especially with recent times with COVID, additional costs, losses in revenue, it's going to decrease the access for those patients. We know that reimbursement is always an issue, and that's definitely a challenge, but the first step is definitely coverage, and that's something that we want to work towards.
Being my mother's primary care provider, or I should say her primary home care provider, I was her primary home care provider for 8 years. Did not want to leave her home, and anything that we could do to keep her in her home. And that's what made her happy. And I think that we need to always strive for that, because someday we're all going to be there.
Absolutely. Well, thank you, Brenda. Appreciate your time.
I think I probably took
And I believe Maggie has joined us now. And Maggie, thank you so much for joining us this evening. And you are ready to start whenever you like.
Wonderful. Thank you so much. And sorry, I'm just chiming here in now, but I was able to catch a little bit of what Linda was and in terms of filling some of those voids that we see quite frequently in our healthcare system. And seeing that, quite frankly, we're not doing what's in the patient's best interest many times. And so, like I said, I'm grateful for this opportunity and for the conversation. I'm just going to jump right in and start kind of addressing some of the questions, if that's okay. Okay, great. So I have, unfortunately, probably too much experience with both physical therapy and family members through occupational therapy. But one of the things that's taught me is just how valuable those services really are. And I got started with physical therapy when I was 15, and like many girls who play soccer, I had the unfortunate experience of tearing my ACL and my meniscus. And again, I was 15 and absolutely heartbroken. And probably the person that I chatted with more than anybody else for a solid month was my physical therapist. And what I was amazed, and this still resonates with me today, is quite frankly, how capable therapists really are in determining what's best for their patients. And I truly wish that we can roll back some of the restrictions and some of the burdens that are placed. So kind of another example of something that happened with me. So after I'm going through therapy, like I said, for my meniscus and my ACL, and after a couple months, I'm still going back more than I should be. And she recognizes, Maggie, you don't have nearly the mobility that you should have. And so it was her that realized that, there's something else going on. And she recommended that I go back and see my orthopedic surgeon. And sure enough, like I had too much scar tissue built up, and they had to go back in and scope that. And I was amazed at, anyway, that still sticks with me today. I'm like, yes, like she knew before anybody else knew that something wasn't right. And so I appreciate that. I appreciate the therapist being able to have that autonomy and do what's right for patients. And quite frankly, a lot of times it just means we got to cut the red tape in there and make the system work more flawlessly. In terms of occupational therapy, I'm really fortunate to have two grandmas who are still alive, who are in their 90s, and also grandfathers who went through after strokes and worked with occupational therapists. And what they allowed my grandfathers and even my grandmas today is essentially continue to live in their homes and age in place. And so when you all ask questions about aging in place, again, there is so much that we can do at the state level to make sure that process is as seamless as possible. And again, quite frankly, it's beneficial for all. It's beneficial for the patients, for the family members, for our overall, the strain on the healthcare system. And so those are some of the things that I really appreciate, again, your work on and continuing to push for. As I mentioned, my husband's a nurse practitioner, and he works for an FQHC, Samuel Rogers here in Kansas City. And quite simply put, the licensure agreements that have to be in place with a collaborative physician, that this undue burden is essentially not allowing enough people to work in primary care. That's what it boils down to. And so some of the areas where you need primary care providers the most, especially in these high need settings and rural areas, because a nurse practitioner always has to be underneath the care of a collaborating physician. Sometimes folks aren't able to work in the areas where they're needed the most. And I'm amazed even today, there's things, even though he's practiced for 10 years now, even to have prescribe shoes for a patient who is diabetic, he has to go back through to his collaborating physician. In order to request home health, he has to go back through to his collaborating physician. And so there's other things where you can, diagnose, you can prescribe on, pretty tough cases, but then there's other burdens in place, like you can't get a patient the shoes that they need. So again, it's some of these ludicrous things that continue to be in place because, quite frankly, those who make the policies aren't listening to those in the field that know what's best. So again, I'm encouraged by by those conversations, and there's so much that we need to do. In terms of number 3, I absolutely believe that we have to continue to support ongoing efforts to expand portability. And this is, we have to be cognizant of the fact that Kansas City and St. Louis are on 2 state lines, and it is essential that we are able to work, in Kansas, and Kansas therapists are able to work in Missouri and Illinois, and vice versa. So I absolutely believe that license should be portable. And again, supporting our military families, as we know, we have between the military bases and folks moving in and out from other fields also where they're forced to move a lot. It's really important that we continue to push the licensure compacts and licensure portability. I feel like I alluded to number 4 a little bit already. So if that's okay, I'm going to jump through that and then you all can ask me questions at the end. Direct access to a physical therapist without a physician referral, without a doubt. This is, again, I think it goes back to providing patients with flexibility as well. And then also once you get in there, and I think I heard Brenda allude to this a little bit too, making sure that we are able to give therapists the discretion to design the treatment plan that is best for their patients based on their own expertise. So maybe I also have the experience of being a long distance runner, and as a marathon runner, I go in with back pain, and then all of a sudden my therapist is like, well, you know what, it's really your hips are completely out of alignment, so let's talk about that. And so again, making sure that we're putting and giving the therapist that autonomy to do what's best in a treatment plan for their physician. The questions here at the end certainly get into, having seniors being able to age in place. I think it's absolutely imperative. And where I live in Gladstone, running for this district, one of the things that seniors talk about a lot is being able to have access to funds to be able to modify their homes to age in place. And unfortunately, again, when we look at reimbursements for different things, we see that many times this durable medical equipment isn't covered. So maybe we can get a bench, but we can't get ramps, which are imperative. Like you can't get into a split level home if we don't have ramps. And so, that's a very typical design here in our community. So we have a lot of split level homes, and seniors are forced to go live into an assisted living apartment, which they don't want to be in, and costs a heck of a lot more than the house that's been paid off, but they just don't have the funds to be able to, like I say, to make the home modifications with ramps or stair lifts or whatever it may be to help people stay in their home. So I encourage by that question and that continued work. And then when we get to 7 and 8, this is all about, first of all, making sure that Medicaid expansion is properly implemented. This was the will of the voters. It's the will of the voters that the Missouri legislature does everything in their power to make sure that this is properly implemented and properly funded. And so I think that speaks, quite frankly, a lot to making sure with Medicaid expansion and again, looking at the whole program, it's unfortunately, and I have seen this both as a teacher, but also as a parent and looking at what you need sometimes through the school districts, through others, to look at getting what it means to have an IEP, and or a 504, and the system isn't easy. I mean, to be quite frank with you. And so unfortunately, sometimes it's hard to qualify for early intervention when maybe a child just has one deficit. And because there's not that early intervention, then once they're able to get care, it simply just becomes a harder treatment. And so again, that's something I look forward to continuing to discuss with you all and your expertise there. So it is, yes, absolutely recovering from COVID on number 8 is imperative before we're able to do anything else. We've got to get a grip on this virus and make sure that we are doing, certainly all of those who are elected officials are doing everything in their power to stop the spread and allow us to begin to recover from this as quickly as possible. And so I do believe that we can walk and chew gum at the same time. So we can make sure that we're stopping the spread of COVID, but we've got to work on other issues. And I see that through making sure that Medicaid expansion is properly implemented, making sure that we're going back and fully funding our schools. Yes, we have a pandemic. Yes, we're going to have a very tough budget situation. But again, we have to be able to do more than one thing at a time. And I'm well aware that walking into the session in 2021, we have a lot on our plate. But the citizens of Missouri put elected officials there to serve Missourians and in their best interest. And so that's certainly what I plan on doing. So I'd love to take your questions or discussions.
Thank you so much, Maggie. I know there hasn't been too many questions from anyone yet, but we also wanted to make sure to see if you had any questions for us and, or if any of the candidates had questions for us as well that we could answer for you, because obviously it's great for us to hear from you, but it's also a wonderful opportunity to have a conversation.
Yeah. So first of all, maybe this is me through my teacher lens, in terms of just wanting to learn from you all. What has your experience been in terms of advocating for policy in Jefferson City? What has gone well, and where have you hit roadblocks?
At least for occupational therapy, we've been very fortunate to not have too many particular issues. One of the biggest issues we did come up against a couple of years ago was there was a bill proposed that did actually end up passing to expand coverage for non-pharmacological interventions for opioid, for pain management, basically. So this was an effort to help combat the opioid crisis. And basically what the bill did is it copy and pasted the CDC recommendations for non-pharmacological management. And unfortunately, occupational therapy was not included on that list. And so PT was, which is great for PTs, but not so great for us, because we know that as OTs, because of our holistic view, because of our ability to focus on ADL, so those activities of daily living and how people live their lives, in collaboration with a PT who's also a lot more of that kind of biomechanical approach, we wanted to be included in that bill, and we thought that we would be. We spoke to representatives, but then when it kind of came through, we were left out. And so we've been looking for those opportunities to readdress that issue and to get added onto that list, because unfortunately, anything that passes through a bill like that, that means that someone who may want to see an OT instead of a PT for those services, they can't, because it's not covered by Medicaid. And I'm not sure if you heard that on the previous conversation with Brenda, but that Medicaid does not cover OT and PT for adults on Medicaid once they leave the hospital. And so that's something that we would certainly love to hear from you, how you would potentially plan to address that, or would you support an effort to expand those access.
Yeah, without a doubt. And so my experience in Jefferson City has been limited, but I had the experience of serving as an intern in the Missouri Senate during the 2006 session. And it's amazing how the whole process unfolds. And unfortunately, it's, at the last minute, that's when a lot of things get done and language is flying all over the place. And you're seeing where you can put your language on different things and making sure that you have a good carrier of your legislation and it's going to get through. Unfortunately, because a lot of bills are wrapped together, things get dropped along the way. And so one of the things that I think is imperative is whoever's carrying the legislation, right? And this is certainly going to be instrumental for me as a member of the minority party, is always to have that broad coalition where I'm working with others to make sure that the language gets passed. But there's always there's always so much room for improvement, and unfortunately so many laws get passed that aren't the right law the first time, right? They're simply a work in progress. And so it is about going back and amending it and tightening up the language, because there's too much that falls into the gaps. And so when I hear that, I just think, gosh, that's just the kind of the unfortunately, the typical situation when we're left in where we're not doing what is right for Missourians, right? And it's costing more. Like the thought that once you leave the hospital, your care isn't covered is just ludicrous. So so instead, right, that physician's going to say, okay, well, I'm not going to discharge my patient because they need this care, and so we're spending more money in the long run. And so, yeah, there's certainly a lot of work to do.
And before we move on to our next representative, I'll just answer that question for the physical therapy side. We've been very successful, actually, in the House specifically. It's in the Senate where we tend to run into some difficulties with our bills. We did have last year, as you guys are talking about how stuff just flies into bills at the last minute, we were able to protect our Practice Act last year when athletic trainers, in their push to expand their own scope of practice, which is awesome. We love our athletic trainer friends. They had started stepping a little over into the neurological side of life. And so we collaborated with them as well as the senator who was carrying their bill to make sure that both sides were fully protected in their Practice Act so that they could have the freedom that they deserve while everybody, keeps going to the highest of their education. Our big push has always been for for the last 2 years has been for direct access to physical therapy. We had really, really good success. The last 2 years, it passed through the House of Representatives with only 3 no votes both times. And then when it goes over to the Senate, unfortunately, it goes to one of the committees and then hasn't made it out of committee. And that's happened both years. So that's usually more where we've had difficulty, and we do have some great senator friends over on that side. We just kind of get stuck in that committee. So we have an awesome lobbyist. He's fantastic. So
Yeah, just keep pushing every year.
We're working on it. Did you have any other questions for us, Maggie, before we go on?
No, that's good. I look forward to working with you all. I know I certainly have a lot to learn on this front. I acknowledge that. But I certainly, like I see a lot of the struggles that I've been hearing from my husband for the last decade and in his field as being a nurse practitioner, I think certainly can carry over to probably some of what you all experience as well, and making sure that the state recognizes that at the end of the day, let's make sure we're doing what's right for patients and in the most recognizing that we have a more certainly some ways to be more fiscally responsible as well with our tax dollars. So I look forward to the future collaboration.
Definitely. Well, thank you so much for your time.
Yes, thank you. You all have a good evening.
You too. So next we've got James Shackerfold from House District 16. You can start whenever you're ready.
Oh, perfect. And thank you so much for having this event tonight. It's an honor to be here with so many members of the OT and PT community here in the greater Kansas City area. And anyone here in the Northland and District 16, hello. I'd love to talk with you if I haven't had a conversation yet. To all the fellow candidates, hello. Nice to see you again as well. A brief intro, and then I want to go into talking about these questions, which is why we're here tonight. I'm James Shackelford. I'm the Democratic nominee here in House District 16. This is a very important House race, not just in the Northland, but across the whole state of Missouri. This is the last red district. I don't want to get into too much party politics tonight, but this is the last red district here in the Northland. I'm striving to flip a blue to join my blue neighbors here in Kansas City. But this race is very important because we're one of 8 targeted House races that if flipped blue this year, we will end the supermajority in Jeff City in the state House. To me, that's much more than a partisan victory. That's a victory for our democratic processes. That's a victory for how Jeff City would function. They would have to listen to all sides on every single issue, which they have not done for the past decade. And in my opinion, and a lot of other people's opinions as well. And I feel that would be a big help, for many different reasons, even with issues that we're going to discuss tonight. So that's the importance of this race. And why am I running for this very important race? I was born and raised here in the Northland. I'm a graduate from the Liberty school system, Liberty High School. I spent 6.5 years prior to running for office, serving and working with the USO organization. They're a nonprofit that aids our military community. And I was very fortunate and honored to travel all over the world for about 6.5 years, giving back to that military community and their families. So I'm bringing a passion for service into this office, which I feel it desperately needs. And I'm striving to be a public servant, not just for the Northland and for my potential constituents, but also for the entire state of Missouri. Really to bring a mindset of embracing differences of opinion, working collaboratively with people from all parties and all sides, just to focus on finding the best solutions for our citizens, for our people. And we can bring that into talking about these PT and OT issues as well. It's about inclusion. It's about finding those solutions that are going to work for everybody, to provide that access for so many different reasons, to improve our healthcare system here in Missouri and in our country. I'm really looking forward, not just to this event tonight, but also to working, like Maggie said, collaboratively with this community and others to improve our healthcare system here in Missouri. There's so many, throw a dart on a dartboard, pick an issue. There's so many things to go off of. But I'm really looking forward to, working with this community and learning more. I like Maggie said, I also have very little experience in this field with PT and or OT. But I look forward to learning and educating myself more on how I can be supportive and how we can be supportive as well down in Jeff City and across our state. Now with that, I'll start going into these questions, and then I would love to take any questions as well from the group tonight. So do I have any experience with PT or OT? I have no experience with occupational therapy. My apologies to all you OTers out there. I have a very little experience with a physical therapist. I broke my foot 7 years ago. My 5th metatarsal, had to recover for about 2 or 3 months. And I worked with the physical therapist throughout that time. I was a performer in a past life, so I had to be on stage and move and dance a little bit. So I had to gain that mobility back. And so my physical therapist, although we didn't meet too often, they definitely were very helpful and gave me a lot of tricks of the trade to help me get back quicker. So I was very thankful for that experience. The next question, I'm just gonna go down the line as well. If you're wondering where I'm going, I'm just going 1, 2, 3, 4, 5, 6, 7. What are my views on licensure and licensure boards? I'm very supportive of them. I think they're something that it's a necessity, for OT and PT and any medical profession, in my opinion. There needs to be some sort of, not oversight by any means. That's not what I'm trying to get at, but there needs to be some sort of, bar that's set, so everyone knows, what's right, what's wrong, what's ethical, what's moral, all that kind of stuff. So I'm very supportive of licensure and licensure boards. I'm also very supportive of going into the next question of improving and having, licensure compacts. I know with PT, they have a 20-state compact. And I know our OT folks are hoping to join one and get one as well, so they can work, in Kansas and Illinois and any other surrounding state, here in Missouri. So I'd be very supportive of that, because, that just opens access and improves access to our, to the people who need these services. And it also will help our OT and PT folks, find more work, which is always good as well. Now this leads me into question number 4. What are my legislative intentions surrounding healthcare here in Missouri? And it's our state for anyone who may need them and anyone who may need access to them. Clearly making it accessible and affordable, that's going to be a big talking point. That's such a big umbrella to say, making it accessible and affordable. Clearly focusing on, cost of prescription drugs, that's going to be a big deal. Talking about straightforward issue. To me, that also includes, I know Maggie touched on this as well, and I wanted to also just emphasize the importance of passing Medicaid expansion here in Missouri. I know Greg touched on this earlier, but that's going to save us a whole lot of money here in our state. And it's going to be up to our legislature primarily to, determine how that is spent, how those funds are allocated. And, it's going to be, I'm going to be right there. Hopefully, if I'm elected, I'm going to be right there making sure that they allocate it, responsibly and efficiently. And if we're able to include OT and PT into that discussion, I don't see why we shouldn't. I don't know, again, having little experience in these fields, I don't know the details of how that will go, but if that's something we're able to do and we're able to put into that discussion when the time comes, I'm very supportive of those discussions. Something I'm also supportive of is direct access to a physical therapist without a referral. To me, that again, and why that is, it's quicker access. It sort of cuts that red tape in that process, essentially for those people who need these services and who just will just make the process easier for them. And for someone who wants to serve the people, making the process easier, that's always going to be a yes in my book, especially for this issue. And then we get to the roles that the state should play with our senior citizens aging in place. This is an issue personal to me as well. My grandmother is 87, soon to be 88. She's in that category of aging in place and needing some of these services just to maintain her day-to-day, her comfortable, how comfortable she is. She has a chip in her spine. That she needs injections probably once a month because of how discomfortable. That's not even a word, discomfortable. So I apologize for my poor English right now. I don't know where my head's at. But essentially, she can't sit down for long periods of time. And I know that I don't know if OT or PT goes directly into her situation, but I know that with greater access to these services issue. Because it's hard for her just to leave the house and be out for a long time and to walk around. And she's someone who has loved nature her whole life. She's a big road trip person who goes see the national parks all across the country. So she loves being outside and loves, adventuring. And that's been limited in the recent past. And with improving our access, I think of her, these same needs. Let's work together to find these solutions and to work on these solutions. I really look forward to getting down there to do just that. So with that, I guess I'll ask my one question about occupational therapists in schools, and then I'll open up the floor if there are any questions for me as well. So my question would be, I guess this would go towards Clarice, with providing access towards children with disabilities with occupational therapy services. Right now in our school systems, are you aware of, is this something that our school children have access to within their schools, or is this something that they have to access outside of schools, privately, either from their homes or in an office?
So I'll speak to it as much as I know. And unfortunately, fortunately or unfortunately, I work primarily with geriatrics. So my familiarity with school therapists is a little bit lacking, but I can always connect you with a pediatric therapist in our area for sure. They do receive access to services through the IDEA Act, right? So through the federal IDEA Act, but also Medicaid does cover occupational therapy in the state of Missouri. There are a couple barriers to access for children who are on Medicaid, and so for both OTs and PTs, we have OTs and occupational therapy assistants. And so it's a different education level, but we do provide similar treatments. So same thing with physical therapy and physical therapy assistants. Currently under Medicaid, Medicaid will only reimburse for occupational therapists and physical therapists and not for OTAs or PTAs, which when you live in a rural area, it's very difficult to find a OT and a PT, and it's much easier to find an OTA and a PTA. So obviously when Medicaid doesn't cover such services, it's very challenging for those families to find and to access these services. And so fortunately, we don't have as much of an issue here in the Northland with that because we're more urban, but it is a significant challenge. And then the main barrier that families face is that Medicaid does not reimburse very much for OT and PT services. So many clinics choose either not to accept Medicaid patients or they accept very few because the reimbursement is so low. And so obviously, when we can't take as many Medicaid patients as we'd like to, it does create a barrier of access for those individuals. So that's mainly the issues that we face. And school districts, while they do receive OT in the school, it has to be very focused on school tasks. So if I'm an OT in a school district, I really have to make sure that what I'm providing an intervention for, which, just for your knowledge, occupational therapists, we focus on what we call activities of daily living, basic self-care tasks. We work a lot with sensory disorders, those sorts of things, really trying to look at the person and their environment and how they interact with that environment, and where can we either help make improvements to the physical body or to the environment to make sure that that individual is successful as possible. So in the schools, we have to focus on school-based tasks. So handwriting, being able to pay attention, their ability to attend to a task and be alert in the classroom. So, but it doesn't really allow us the opportunity to work on other self-tasks, like being able to feed yourself, tie your shoes, put on a coat, the things that you would need to do beyond the classroom. And so that's where some of those limitations come into play, where families seek out therapy services outside of the classroom, is because in the schools, we're a little bit limited on what types of interventions we're really able to provide.
Got it. Thank you so much. And if there's any questions for me, please feel free.
I think one of the questions that we received is, how would you continue to advocate for PT and OT, either once the COVID crisis is over or as the COVID crisis continues, as we are essential healthcare workers and many of us have been impacted, or I would say all of us have been impacted by this issue?
Sure, and great question. And so currently we are still going through this, especially here in Missouri. And I've been very, as a lot of us have, dissatisfied with how our state has responded to this crisis and to this pandemic. But ways in which we can help now, and as we see our way out of this pandemic, hopefully sooner than later, is to do what our state has not been doing, is putting our health and safety first, not just of our citizens, but especially of our essential workers who are on the front lines each and every day. That is providing not just enough supplies and PPE equipment, but perhaps more than what's required, so we don't run out and there's no, we're not stretched thin for that very essential equipment. This pandemic, in my opinion, it's going to be not just next year, but for the foreseeable future, it's going to be a top priority of our legislature, not just with how we recover from it, but and how we help our healthcare industry and all of our workers in it, through and beyond, and then the economy, and then our schools and everything else that's been affected by this pandemic. And it's everywhere, and it's every facet of our society. But as a potential representative in Jeff City, thinking about how we recover all of those layers of our state at once, to me, being younger, being not as experienced with how Jeff City works, a big thing that's going to help me and is educating myself, and to do that, it's having conversations like this. It's reaching out to the experts, our essential workers who are on the front lines, who actually know what's going on, and they know what the needs are, and your ideas and your advice and thoughts on what's happening now, what has happened, where do you think we should go, what do you think you'll need going forward. Those are questions I'm going to ask. I don't know if they have been asked already. If they haven't, they should have, in my opinion. But bringing more people into the fold and to the same table, so everyone knows what's going on. So there's not such a big divide. I feel like there's been such a big divide with how our state has responded this far, and I believe that's a big reason why we're in, I don't want to say the mess, but we're in this current situation we're in right now. With I think today we had over 1,300 new cases reported, and that number is rising again, unfortunately. I feel we could have avoided that by being proactive. So that's something I look forward to doing as well, as being proactive and looking for proactive solutions, and not just waiting back and having to be reactionary to what's going on, trying to get ahead of it and trying to predict as best we can. And to do that, that's again having conversations with the experts, with what they think might happen, getting everyone together so we can be proactive and not reactive going forward. That's to me one of the only ways we're going to actually start to recover from this. And then once the day that we have a vaccine, or the day that we don't have to worry about social distancing anymore, whenever that will be. I know we're all ready for it, but whenever that day comes, it's not like poof, everything's gone back to normal. That's when the real recovery begins, and that's when I think these conversations and being as connected as possible is going to be essential. Not especially for our essential workers, healthcare industry, but in all facets of our state.
Awesome. Well, thank you for your support, and we'll appreciate your support in the future, definitely, as we move through the pandemic and beyond. For the sake of time, we are going to go ahead and move on. And then really quick before we start with Mr. Brandt, I do just want to remind the therapists on the call that we did have a last minute cancellation from District 17, Mr. Mark Ellenbrock. And then we did have a few, we've been posting on the Facebook page, representatives and senators who have responded to the questions, but were unable to make it tonight. And we will have 2 more submissions on there. So Annette Turnbrough from District 37 and Rhoda Dolan from District 31 both messaged today that they were hoping to attend, but we're already kind of full since we're going to go till 9. So both of them are going to type up submissions and we'll post it on the Facebook page. So if you're a therapist in those districts, make sure you check that out before you go to the polls in November. Okay, without further ado, Mr. Brandt, whenever you're ready.
All right, thank you so much, Stephanie. It's my pleasure to be here tonight. My name is Brant Verks. I'm running for House Districts number 17. Mark was my opponent, so I was actually kind of sad that he had to attend a different event today. I was looking forward to both hearing his opinions and also seeing where we can work together to make sure that no matter if it's me or if it's him going to Jeff City this coming year, that we're making sure we're doing the best for our community. And so for District 17, in case you're not familiar with what that House District entails, that is Eastern Kansas City, that's east of Brighton Street, also includes Clay Como, Pleasant Valley, and then the southern part of Liberty. And there's some other small like Glen Eyre and Birmingham. But overall, a little bit of background about me. There was another representative earlier that spoke. I'm also a lifelong Missourian. I was born in Branson, Missouri. My parents went to the College of the Ozarks, and after they graduated, we moved up to Grain Valley, Missouri. And from there, I went to school there. I graduated high school and went to Mizzou, where I got my Bachelor in Science in Business Administration degree. Moved back to Grain Valley, and for the last 4 years, I've been working for Cerner as a senior learning consultant. With that job, it's allowed me to travel across the country to work in dozens of hospitals in 9 different states, if I remember correctly, and interacted with hundreds of nurses and hundreds of doctors, both in the train aspect where I help them learn how to interact with our software, while also at the same time, when we turn on that switch and that system goes live, I work directly alongside them, helping them answer questions or figuring out troubleshooting if there's some sort of technical glitch. And so that's allowed me to see behind the scenes where, even though I'm not clinical by background, I haven't gone to medical school or anything like that, I have been able to see what goes into that patient care relationship, working with the patient. And I also had the opportunity for several months to work with the Southwest General Hospital in Cleveland, Ohio, as part of a therapy project. And so I was working with occupational therapist, speech language therapist, and physical therapist. That was the main target of that project. We were implementing a new software there. And so overall, I've been able to go around and help and see that experience. But when it comes to this year, I've been blessed to not have to worry about needing any personal occupational physical therapy. However, as I was mentioning, I've been able to interact with many different therapists in my career, both on the adult level inside the hospital setting, as well as I used to be part of the maternity and newborn nursery areas. And so I was actually able to interact with the occupational therapists and physical therapists in regards to our newborns. So I got to see a little bit that different aspect there as well. And so then going on to the next question with licensure and licensure boards, overall, that's, I think, as many of the other candidates have shared today, those are very important. And I think that making sure the way that they're composed right now allows for the best outcome. I know that making sure that we have our main therapist, we have an assistant, and then a couple of representatives for the community at large. That helps make sure that we're targeting, making sure that all of our activities are proactive in nature. And also, going on to that next question when it comes to licensure portability, I think just as every other candidate has shared here tonight, that is very important, especially as we're looking to implement Medicaid here in the next year. And as we're looking to help Missourians as a whole when it comes to healthcare, one of the aspects we have to consider is not only the cost of what it takes to implement such a process, but also the quality of care that our patients are receiving. And so when it comes into, we have more patients that are able to get the care that they need, we want to make sure that we have enough physicians, and we have enough therapists, and we have enough therapist assistants that can provide that care. And so that we don't have, no one has to feel rushed where it's like, oh, I have 10 minutes to take care of this patient and 10 minutes to take care of this patient. That we can actually dedicate some time to make sure that our patients get true quality care and that they gain the most out of each of their appointments. And so working on the compact to have that portability within Missouri and with other states allows for more therapists to be able to work in Missouri, to make it easier to practice here, and to make sure that our patients have that ability to have more choices, more options, and making sure that they can get all the care that they need. And so when it comes to legislative intentions, when it comes to healthcare overall, obviously I have some background in it, but as many other candidates have shared here, I'm always learning. I'm very thankful that this town hall has been here today. I've enjoyed listening to all the different candidates. I even shared the link to this broadcast to my social media page because I think that the members of our community can find this information very important too. It's very important as we continue to work on that, that we're doing the best to make sure that Missourians have that quality care. And so when it comes to my intentions there, I don't have any particular bills that I was planning on in regards to that. However, what I do want to support is anything that allows patients to be able to receive care easier. I am friends with a company that works directly with elderly populations to receive in-home care. And so I have been able to see the process that goes with some of that in-home care. And then with my current project for Cerner, I'm working with the Department of Defense and VA. And so been working with the telehealth nature of some of the care there, as well as just the care when it comes to our VA facilities. And so I've been able to interact with some of that project there in that case. So being able to do whatever I can to hear from groups like this to make sure that either compact, it can be enabled, or whether it's making it easier for therapist assistants to be able to see patients, make sure Medicaid or other insurance compensates for that appropriately. Those are things that I want to be able to support. And so same thing with number 5. I think as most of the other candidates have shared here today, that having that direct access is important. I know for me, I actually just had a car accident recently, and I didn't have to go to a physical therapist, but as one of the other representatives shared earlier, they were able to go, you could go directly to a chiropractor without having that referral. And so when it comes to physical therapy or occupational therapy or even speech language, all 3 of those things should have the ability to, I shouldn't have to go to the doctor, pay that copay and those costs, and then have to go to the therapist. If I know what I need to get cared for, I want to be able to get that care directly. So being able to have that as part of our legal nature, I think that's definitely positive for Missouri. And then so in questions 6 and 7 regarding our senior citizens and then children as well, I think most of the other candidates have shared a lot of great information. There's not a whole much I can add here, except for the fact that I think most of them covered the very important points where being able to make sure that those who are senior citizens can have that care at home, that they can have the dignity of their life to be able to stay within their homes, and also to save costs for that matter. I think that that's important, especially as we're dealing with coronavirus and as we're dealing with the economy as a whole. The more we can be efficient in our spending, the better overall we can be. And then lastly, with regarding children with disabilities, obviously we'll be working with Medicaid, the Medicaid expansion this coming year and next years in general for that matter. And so making sure that when we implement those processes and we're determining whatever needs to be determined in those regards, that children can receive that care, especially when it comes to disabilities. Again, me and my wife, we actually are very close friends with a couple that's blind. And so their child is not blind, but we've helped them go to different locations, help provide care, try to help them in different aspects. And so when it comes, we've learned some of the things that goes into disability, Medicaid, and some of the other aspects when it comes to receiving adult care. And so looking at children care is just as important, if not more important, as that helps establish that child for the future. And then wrapping up, I know we're getting pretty close to our end time here, but with COVID situation here, making the best way I think that we can make sure that we're supporting you in your roles is that you're receiving the proper PPE equipment. And obviously in Jefferson City, we have a lot of information we're processing. So the more that we can work with our county public health officials and those public health centers to be able to distribute those resources that are more close to that are more interactive with our communities and some of those aspects, making sure we're getting that information with them as well. I think that's a great way for us to be able to handle that. And overall, the more we can work together to help our communities heal, to become healthy, will help us be able to get to the point where we'll be able to return more back to normal state. I know we're running out of time here, but I'd love to open up for any other questions or comments.
Thank you so much for taking the time and answering questions. If you want to drop your email and your website in the chat, and then if anybody has any questions, free to please email him. And then last and certainly not least, we have Mr. Wes Rogers from House District 18. Thank you so much for rounding out the end of our session here, Wes.
Yeah, thank you so much for having me. It's bedtime at my house too, so I apologize if it's a little bit noisy. And I'll make mine pretty quick because I know it's been a long night. Wes Rogers, State Rep for the 18th District, which is southwestern Clay County. Most of my district is the city of Kansas City, but it also includes the cities of North Kansas City and Avondale. I personally do not have any experience. You say hi, buddy? Yeah. Okay. I personally, and I'm fortunate so far, do not have any personal experience with occupational physical therapy, but I think the conversation we need to have on that is not, whether or not we have, but knowing that we all probably will at some point, and certainly everybody we love will. So this is just an incredibly important piece of all of our lives. As far as licensure goes for healthcare professionals, my wife is a doctor. We talk about this a lot at home, and I'm a lawyer. So for me, my background as a lawyer, we're a self-governing profession, and that seems to work well. And when you go to school for that long, and when you're well trained, like physical therapists and occupational therapists are, my preference is always to let professions govern themselves as much as they can, and keep everybody else out of it as much as we can. On the licensure portability for occupational therapy, we had that similar bill for licensure in general for reciprocity last year. And I've got real mixed emotions on that. I'm all about making things transferable to help people and to help employers, so long as Missourians are getting a fair deal. I didn't like what we did in the legislature last year, where we said we'll accept licensure from other states, regardless of whether or not they accept Missouri licenses in their states. I wouldn't call that reciprocity. I would call that more of a one-way street. I would be inclined anytime that we can get together with another state and agree that we can have some sort of reciprocity for lawyers, for healthcare professionals, or for anybody else. I think that certainly makes sense. And then the one thing, and I know it's been a long night, so I'll wrap up. The one thing I didn't hear that I think is worth talking about a lot is when we're talking about any kind of healthcare, but especially what you all do, which is getting people back to being healthy. This is a major part of workforce development. So we need to do everything we can to make sure that people have access to physical therapy and have access to occupational therapy so they can get healthy and get back to work. And we spend so much time talking about workforce development in the legislature, which I love because I think that's really important. But sometimes I get frustrated that maybe we're talking about it in the wrong way. And if we're serious about workforce development in this state, it's making sure that you all have the resources that you need and people have access to your care that they need so they can get back to work, and then they can provide for their kids, and so that they can be healthy parents and healthy grandparents. So I don't have an opponent. I'm thankful for that, but I'm around. So if anybody wants to talk to me prior to next legislative session, my cell phone number is just about everywhere. So is my email. Contact me via email or cell phone, and I'd be happy to chat.
Thanks so much, Wes, for rounding us out here, and we hope to see you up in Jeff City soon, whenever they'll let us come up and actually be there.
Absolutely. And just so you know, for our licensure compact bill, and this is the same thing for physical therapists, the only way for a state to participate in the compact is for them to also have passed the compact. And so that's the nice thing, it's a little bit different from that reciprocity. So that's the great news about our compact bill, is that someone can't just take the Missouri license and go somewhere else. They also have to be part of that compact as well. So it is going to be a very collaborative approach, which we like.
Yeah, that's perfect. That's great.
Fantastic. Well, thank you so much, everyone who's attended tonight. We did go ahead and live stream the event on YouTube, so that recording will be available for any of the candidates who'd like to share it, but also for those who may want to share with their friends or family who are also PTs and OTs who weren't able to attend. Stephanie and I will go ahead and put our emails in the chat as well. You can always reach me at motapractice@gmail.com. That's my MOTA email. And so we're here to serve as a resource for not only all of our practitioners and students, but also for our candidates as well. If you ever need a candidate in your, or a constituent in your district that you need to talk to, or that you need to serve as, a expert in our area, please let us know. And we're definitely here to serve as a resource to get you connected with someone in your district. Alrighty, well, thank you so much, everyone, for attending, and we hope to see you at future events. Have a good night.
Thank you. Take care.
Thank you.